There's going to be 2 recordings for today because I've cut it off for the morning and afternoon. But so you'll have 2 different ones. I'll try to label it as AM and PM. I only have 8 followers on YouTube. I'm kind of feeling sad about that. I feel like a big loser. Thank you. I have 1 fan. My kids have made fun of me because I'm such a loser with only 8 followers, or whatever it means. Okay, those 8 are going to do well though. I think 3 of them are me watching myself to see if I am teaching it right. Thank you. Did everybody get this? This is chapter 44's. I think those are the workbook pages or something she had done off for y'all. Maybe a little bit of extra Inklex stuff at the back. I'll try to get some more Inklex for y'all for this. Any questions so far about the stomach and the colon? It's pretty simple. It ought to be an easy test because all your nursing measures are the same, right? No caffeine. I know. Small frequent meals. You're going to get throat punched before this 12 weeks is up, and I mean it. I'm ready. I'm itching. What?
What's that movie where she steal that man identity?
I love that movie.
Oh, Tammy?
Yes, Tammy. It turned out good though at the end. She was a sweet person.
That's where she was in jail at the end. She was supposed to be
You didn't know
Josh, you should have seen her for Halloween. She was Tammy.
That's funny.
Let me see.
Yeah, I want to see the picture.
Her hair is red in the movie. She looked like it was Jason Bateman. Oh, no.
While she's finding her stomas, y'all know what a stoma is? The opening on the outer wall. It could be when we were doing urine, the urostomy, but it can also be a colon, so it's a colostomy. What are your nursing measures you're going to check for?
She did good. She did real good. That was so smart.
Y'all are going to see her on the news for America's Most Wanted.
Let me see it. Wait.
Yeah, go ahead. It's worth
Yeah, that's thirsty.
Did you come to school like that?
No. No.
We get to dress up.
No.
We don't even have nursing day.
What are you talking about? Y'all remember Glenn? Was that
One day out of the week, they pick one day for each
Yeah.
double week where
No,
the
he's still
I know we can't even have, we got an email yesterday about the flyers, you know, like when they're selling popcorn and all that stuff, we can't sell flyers. Because my little ones were going to do something and we got in trouble. They said they look bad.
Okay, but the foot massage in the Korean place, like, really? We're in a whole bowling alley and they're worried about flyers?
It's priorities. Wait, guys. Alright, so with this stoma, always check skin integrity. Like we talked about that question. If it's pale, that's not good, is it? It must be beefy red. I'm not sure. I'm sorry. It's on, what page is it on? Stomas. We're still in chapter 44. We finished with the, and it wasn't much. That's only one slide. I think it's just included in when you're talking about the colon. 1441. Yeah, there's a picture of stomas at the bottom there. See all 3 of them? So it may just be the reading. Just know that first time you're going to check that skin integrity, and also assess for allergies to powders or adhesives. Because remember, they have those little bags that you put on them, and if they are allergic to the stuff that you're putting on them, you're just going to make more problems, aren't you? And you could, damage the stoma itself, and you do not want to be the one that goes into the doctor. They have to take that patient back to surgery, cause a lot of problems if you put baking powder or something on them that they're allergic to. Okay, and then you're going to have to do a lot of teaching again about changing their pouch. about abdominal inflammations. These are the three things. Itis, we know that means inflammation, infection. So appendicitis, diverticulitis, peritonitis. I gave y'all the peritonitis one. So we're going to go through these real quick. They don't take long. Appendicitis. Anybody had their appendix out? Have you really? Did it burst or you just had it out? Last year? If they've had their appendix out, then it should be good on that. However, most people still have theirs. It's a real tricky little thing because it's kind of vague symptoms at first. It's tiny. The appendix is located in the right lower quadrant, so here's your ascending colon, transverse, descending. It'll give us ascending, right? It's right there at the beginning of the colon, your right lower quadrant. It's usually, when it gets bad, it's acute. It starts off real vague, like the first couple of hours, and then all of a sudden they are double it over. Okay? They have rebound tenderness. Bless you. You push down. Does everybody know what rebound means? You're pushing down and it doesn't hurt them, but when you let go to come back up, that's when it hurts them. Because pushing down puts pressure on it, it feels good, but the second you let go, it hurts. So that's rebound tenderness in that right lower quadrant, over where the appendix is. It's just like a little appendage of the colon, and it can get inflamed. It's stuffed stool or something gets down in there and it irritates it and causes just like an abscess in your skin. And so it gets inflamed, and it bursts, and all that infection is now in your peritoneal cavity. And so that's what appendicitis is. They get septic real quick. They have nausea, loss of appetite, white blood cell count. We know our limit is 10,000, right? So if it's above 10,000, infection. And then they have to have emergency surgery to get that out. And if you've got to watch one, they're pretty cool. They literally wash it out. They just take water or saline and clean the whole abdominal cavity out to get all of that infection out. And then they just sew up, they cut it out and sew up where it was, and hopefully give them lots of antibiotics and you're good. So just know, fever, high white blood cell count, and rebound tenderness over the right lower quadrant. Appendicitis. That's NCLEX. They love that one because it's very common. Anybody know who would be high risk for appendicitis? Sudden rupture? Yep. What'd you say? Somebody said kids?
I said some kids.
Well, little kids because they were rough, but somebody who just had a baby. They've been pushing, and it's ruptured. It's real easy. So they may come in 2 days postpartum with belly pain. They've put it off because all of their endorphins are still working, but they're running high fever, and so it's appendicitis if they had it naturally. Okay, diverticulitis, or there's two, diverticulitis and diverticulosis. See that how they're different on the end? And this was a question for tomorrow, so you might want to jot this down. Diverticulosis, the first one up there, is the presence of the pouch-like herniations through the circular smooth muscle of the colon. You've got these little pouches, and they collect stuff. And then it turns into diverticulitis when one of those little pouches gets inflamed, kind of like the appendix. It just gets full of something, gets inflamed, and it turns into diverticulitis. Okay. This happens when you're, unfortunately, when you get to 40, everything starts falling apart. Everything. And then you have this. So usually not in young people. This is middle age to older age. If it gets bad enough, it can perforate just like the appendix, and all that mess spills out into the peritoneal cavity, or not peritoneal, perineal cavity. And then they'll have abscesses, hemorrhage, all those bad things that we don't want them to have. Real common. These are the ones they can't. Does anybody know what they can't eat? What foods? Seeds, peanuts. Yep, that's another NCLEX. Because it's very common. They don't want anything tiny that can get down in those little pockets, because that's what clogs it up and makes it get infected. So,
Strawberries.
the seeds, yep. Forgot about that one. Good one, Ashley. Anything with little tiny seeds that can get down in your bowel.
What is it with lettuce that makes it so bad? Because I'm not allowed to have lettuce.
I don't know unless it's just a roughage. I haven't heard
I think
lettuce.
it breaks down or digestion.
Maybe it's a fiber. Everybody got that slide? Just no seeds. We don't want it to get down in those pouches and get inflamed and rupture and cause peritonitis. So they come in with pain. It's usually in the lower belly. Fever, elevated white blood cell counts, similar to the other ones. But this one, look where it's at. Left lower quadrant. That's the difference, okay? So right lower quadrant is our appendix, but left lower quadrant is going to be that colon, because that's where it's coming down to exit the body right before it gets in the rectum. So right in here, left lower quadrant is going to be your diverticulitis. Know those differences. Because that'll say, patient comes in with either right lower quadrant, patient comes in with left lower quadrant. That way you automatically know what you're talking about. Diarrhea, vomiting, nausea. All the same GI stuff. It's just the location is different. Okay? How good on that one? Alright, they'll have an ultrasound or CT, because anybody that's coming in, we can't just cut them open right away. But they'll take them to CT or ultrasound and check to make sure the belly's not completely ruptured and hot. Again, this talks about to teach them, you're going to manage their diet, no seeds, probably no fruit or vegetables because of it's all fiber. And they got to be managed for weight loss and, again, malnutrition. We don't want them to not eat. They got to eat something. If they have flare-ups, they can give them antibiotics, and they may need surgery. But a lot of times they just have a flare-up, and they can give them an antibiotic that cools it off. They don't have to go through surgery. Did I give out the peritonitis one already? Alright, peritonitis. This is the whole abdominal peritoneal area. Something has happened, like I said, the friend's dad was in a wreck and it ruptured the bowel, so now his whole abdominal cavity is full of E. coli. It's severe abdominal pain. Nausea, fever. They're throwing up because their body realizes it's being poisoned. It's trying to get that poison out. They can do x-rays, CT lab, all of that. And they usually give them pain medicine first because it's so severe. It's the most severe because it's a larger area, right? Appendix is just a little corner on the right. Diverticulosis or itis is on the left. But this is their whole belly. So they give them pain medicine and then give them high-powered antibiotics and do surgery to clean it out. And this is the one I gave y'all the handout on. You can look at it while you're studying. Hernias. Anybody have a hernia or their baby had a hernia?
My baby got a hernia. They said it's going to go out of town.
Umbilical hernia? Yeah. You let her cry too much.
She cried too much. Hey.
That's what they say. That's what they say makes the umbilical hernias come out because they're
My said I
pushed
need to
off.
put a 50-cent piece on it. I think that's
Just put her a little snuggie.
I told my doctor that, and she said, yeah, that's the old people remedy. She said, but if Brittany want to do it, let her do it. I thought I was just for those. Yeah, she was already
Umbilical. Alright, so you can have the external ones where it's just on the outside, like a abdominal opening or a weakened area in the wall, and it's visible protruding mass, like the umbilical hernia. You've seen babies that have one around the outside, or a man, sometimes they'll have one if they've gained a lot of beer weight. Sometimes it's painful and they might have nausea, but if it's left untreated, they can wear a little binder. Some women that have them like to wear, like after childbirth, they get a hernia real bad, so they'll put a binder on them. Sometimes they use surgery to correct it. How old is your baby?
4 months.
So they're not going to do surgery that early.
She
When-
said,
when did
she
they
said
say?
12 months, and
Yes.
if it ain't went down, she'll recommend it to somebody. But it's not big, it's just like, she said as long as you can feel the squishiness of the bubbles, then it's okay.
So you just keep an eye on it, monitoring it, right?
She didn't even put one out in there.
Well, it don't stop. Mine's still 19 and he's still fussing. Okay, so that's on the external. That's one you can see, and like I say, you want it to be soft and pliable. Sometimes they repair them surgically, sometimes they resolve, or sometimes you just live with them. But a hiatal hernia is a little bit different. It's a protrusion of the stomach or the other abdominal organs that goes through an opening in the diaphragm. So it's pushing up. Your abdominal organs are going up into your respiratory cavity. So that has to be corrected usually with surgery. Nursing care is going to be the same. We're going to watch them, maybe put an NG down, watch the respirations, all that kind of stuff. We don't want them to have any complications. What is it? Okay, then they can have what's called an intestinal obstruction. This is not like an impaction, but it's something's wrong. Either the intestinal tract has gotten twisted on itself. Could be babies have done that, had that before. Something in the bowel is not working. Those nerves are not telling the bowel to move, so now the bowel is just stopped. You want to listen for the bowel, like bowel sounds when you're doing assessment on these. They come in, they have belly pain. You're always going to listen for bowel sounds on anybody with belly pain. If it's loud and frequent and high pitched at first, that's because it's still getting moving, but the pressure's tighter. So it's going to be high pitched, loud sounds. In the later stages of a bowel obstruction, there's no sound because now it's completely kinked off or it's completely blocked. So if you had a question about somebody that came in, they had belly pain, and you listened and you heard frequent, loud, high-pitched sounds, are you going to pick that that's normal?
No, that ain't
No, it's never normal. But now that they're absent, then you would report that. You're going to need an X-ray. You're going to do some studies because that's not what you should be hearing. Okay. Pain, flatus. What is flatus? Flatulence. Gas.
I thought it was Gladys.
Flatus, I guess that's why I say it because I'm country. Cramping. And then anytime you're having gas, you're going to be cramping. Okay, that hurts. Look for abdominal distension and tenderness, bowel sound changes. And then, like I said, we're going to do X-ray, CT. They may draw some lab to make sure their white blood cell count's not too high. Decompression of the bowel. How do you decompress the bowel? NG2. Good job. If your less invasive treatments aren't effective, they may have to do surgery to go back and repair that bowel. But sometimes when you drop the NG tube down in them, it suctions out all the stuff that's pushing the pressure and making it twist more. So then, once you get that pressure off, the obstruction will resolve itself. But most of the time, they end up having to go to surgery. So NG tube is your friend on gastro. You're going to put one out on everybody. Same interventions. Watching for dehydration, watching electrolytes, giving them pain meds. Why do we want them to turn, cough, and deep breathe on this one? Yes, and also, where is the hernia, the hiatal one? It's going up above the diaphragm, so they're not going to be breathing as deep. So they're going to have shallow respirations. What does shallow respirations lead to? Pneumonia. Good. Okay, y'all got that one? Break? Y'all need a break? Okay. Y'all have a break? Y'all have a break in this bunch.
It is hot.
It is
Come
hot.
back after lunch, but I'll be ready later.
I know. Y'all need we need a coffee machine. Everybody after lunch tells you that. I guess I'll put y'all to sleep. We'll take a real quick break, and then we're almost through. This isn't much. And then y'all can have time in between this and your Skype session. Any questions on test instruction? Yeah. I don't know, that's where Allison said to. I'll check my phone and see if she's told me something different.
So are we taking a break right now?
If you need one,
Okay.
a quick one.
But you don't understand how I wave like this. Do you think what we're doing about you?
And it's the same. It's fast. We have colorectal cancer, and really we don't even have to do blood. It takes us up tomorrow. I thought we could do like some review tomorrow. Do our ankle installations. We have
You know how you want to get a whooping? I usually get out at 3:30, but I'm not getting out until
yeah, we get out at 3 today, but then you don't have that thing. Yeah, we have colorectal cancer, fecal incontinence, and then C. diff.
Is they still you?
So we're almost done. I just thought we'd go ahead and get it done while we had time, and then that way if y'all have questions or you want to do something different tomorrow, we can. I like to get all of it done, and that way you have a whole extra day to review or prep.
You thought I had to do
Girl, yeah, she had baby. It's crazy. They all come to work and I ain't know it.
Should I read it?
I said, is she? I was like, oh my God, at the end, she wasn't walking regular no more. She was real slow to that car. No, they walking in the car from each home too. That's how I used to feel. Asking is hard for the parking lot.
Are you going to be in here while we're Skyping with Dr. Doolittle? Okay. Just making sure. We're almost there. All we have is 3 things. Colorectal cancer,
Yeah, I'm gonna wait till you're done.
and
I'd just like to hear it and then.
colorectal fecal infection, and then C. diff. It was an easy. This will be an easy test for you.
I get nervous anyway. Every test I get nervous.
It's just because it's a test. But you're doing good.
I know.
Do you take anything to help you, like?
No, now everything's more relaxing for me, you know?
Just drink 1 cup of coffee and get it. Oh,
We're
gosh.
supposed to go to a meeting.
Right now? Where at?
Street 14.
What am I supposed to do with all this?
Well, I have students too, so they're just gonna have to.
All right.
So it's just take 15 minutes.
Okay. Y'all get a break then. What happened?
She got to go to a meeting, so break until she comes back. Right?
Yep.
Well, you better stop that because it's been recorded. I'm gonna see a lot of gibberish.
So basically, we're done.